Dr. Reusch here from Vet Triage. We are continuing through this May 1st, 2014 edition of JAVMA, and we're going to be talking about a study in cats regarding pancreatitis. This study comes out of Zürich, Switzerland, vet school there. Agreement of serum, feline pancreas-specific lipase and colorimetric lipase assays with pancreatic ultrasonographic findings in cats with suspicion of pancreatitis, 161 cases from 2008 to 2012. Objective is to investigate the agreement of a feline's pancreas-specific lipase assay and a colorimetric lipase assay with a 1,2-O-diaryl rac glycero 3-glutaric acid 6-methylserufin ester substrate with results of pancreatic ultrasound in cats with suspicion of pancreatitis. So just real quick, that whole chemical compound, that ester substrate, they abbreviate as DGGR. So I'm going to abbreviate that because it'll be impossible to get through this otherwise. Also for these videos, I'm going to start at the end giving a piece of advice for veterinarians and how this paper relates to their practice, and also to pet owners and how this paper relates to pet owners' concerns. So try to make this a bit more applicable for folks in real life. So objective is to investigate 2 different types of blood work with pancreatic ultrasound in cats that have suspicion of pancreatitis. This is retrospective, 161 cats. Procedures include that they had the 2 blood work done and the same blood sample for a cat undergoing investigation for pancreatitis within less than 24 hours between when the ultrasound and the blood work was determined. Results found there was agreement between lipase and the ultrasound. It was substantial agreement. Also, ultrasound diagnosis of pancreatitis had fair agreement with blood work, and that's specifically with the pancreas-specific lipase for felines at a concentration of 5.4 micrograms per liter or more. The greatest agreement was between feline pancreas-specific lipase at 5.4 micrograms per liter or greater and DGGR lipase at over 26 units per liter, along with ultrasound findings of hypoechoic and mixed echoic pancreas or hypoechoic pancreas or enlarged pancreas. In conclusion, the results of both tests need to be interpreted with caution. So just to explain something, because those results might be confusing. When they look at different blood measurements in comparison to another blood measurement or ultrasound or whatever, they're going to try and figure out what is the optimal abnormality in the blood work range that correlates the highest with the other test you're comparing with, like ultrasound in this case. And then from there you can test sensitivity and specificity. So when they have cutoffs here of 5.4 micrograms per liter of lipase and 26 units per liter of DGGR lipase, that's a sweet spot as best as they can figure out with those results in comparison with ultrasound results that show that there's evidence of pancreatitis. So it might be that these values are inaccurate, meaning that some animals have pancreatitis that don't show up on ultrasound, but have less or greater than values to the ones they measured. But this is their sweet spot. This is where all those factors converge, and you have the most ideal scenario where ultrasound abnormalities are correlated with the bloodwork abnormalities at that cutoff point. All right, introduction. Feline pancreas-specific lipase concentration determination and pancreatic ultrasound are 2 tests considered key tools for diagnosing cat pancreatitis. A newer catalytic lipase assay was validated for feline serum and compared with the feline pancreas-specific lipase assay in another study for pancreatitis in cats. Results of the 2 lipase assays agree substantially, with the DGGR lipase assay appearing to be a more cost-effective alternative. The following ultrasound variables are considered for a diagnosis of pancreatitis in cats: pancreatic size, pancreatic echogenicity, echogenicity of the surrounding mesentery, peripancreatic fluid, and cystic appearing lesions. Materials and methods. These cases came from 2008 to 2012. Cats may have had anorexia, lethargy, vomiting, or signs of abdominal pain. The feline pancreatic specific lipase assay with a cutoff value of 5.4 micrograms per liter or greater was considered. Serum DGGR, DGGR lipase activity. Reference range of 8 to 26 units per liter was measured based on a recently validated in-house assay. The results of histological evaluation, so biopsy from surgery or from necropsy, were also included when they had those biopsies available. Results found mostly male, 67.1%, median age 11 years, mostly domestic short-haired cats. When looking at feline pancreas-specific lipase and DGGR lipase, 47.2% of cats had feline pancreas-specific lipase concentrations, and 53.4% of cats had high DGGR lipase activity. The agreement was substantial. When looking at ultrasound, 46.6% of cats had an ultrasound diagnosis of pancreatitis, 38.5% had a hypoechoic or a mixed echoic pancreas. When looking at ultrasound versus feline pancreas-specific lipase and DGGR lipase, feline pancreas-specific lipase concentration was high in 61.3%. In the remaining cases, when ultrasound that had a normal pancreas, feline pancreas-specific lipase concentration was high in 34.9% of cats. With the DGGR lipase activity, they were high in 65.3% of cats with ultrasound findings of pancreatitis. In the remaining cats with a normal pancreas and ultrasound, DGGR lipase was high in 43% of cats. Pancreatitis was diagnosed ultrasonography in 60.5% of cats with a high feline pancreas lipase concentration, and in 34% of cats with feline pancreas-specific lipase concentration within reference range. An ultrasound diagnosis of pancreatitis was found in 60% of cats, a high DGGR activity, and in 34.7% of cats with a high DGGR lipase activity. So the agreement of ultrasound versus feline pancreas-specific lipase and DGGR lipase. The agreement between ultrasound of pancreatitis and high feline pancreas-specific lipase was slight, and the agreement between ultrasound of pancreatitis and high DGGR was slight. The highest agreement between ultrasound and feline pancreas-specific lipase concentration was found when the pancreas-specific lipase concentration cutoff was set at over 16 micrograms per liter, and the highest agreement between ultrasound and DGGR was found with a cutoff at over 57 units per liter. So discussion. There was only a slight to fair agreement found between pancreatic ultrasound and serum lipase determinations, with the best evaluated ultrasound variables being a combined hypoechoic and mixed echoic pancreas, or hypoechoic pancreas, or enlarged pancreas. One explanation for the poor agreement between ultrasound and the bloodwork could be that there were too many false positive ultrasound diagnoses. Previous pancreatitis may have gone undetected or been misdiagnosed, but pancreatic ultrasound abnormality is still detectable. Similarly, even with an in-depth medical history, it's virtually impossible to rule out previous episodes of pancreatitis in feline patients. Also, we cannot rule out individual age-related changes to the pancreas. Also, there could be silent chronic pancreatitis without enzyme release, but with sufficient ultrasound changes of remodeling. Also, there could have been too many false negatives with pancreas ultrasound. Another study looked at acute pancreatic necrosis and found peritoneal effusion, hypoechoic pancreas, hyperechoic mesentery, and ultrasound diagnosis was only established in 7 out of 20 cats in that study. In another study, looking at acute necrotizing pancreatitis in cats, chronic non-suppurative pancreatitis before necropsy, and ultrasonography normal pancreas was found in 50% of cats with both acute and chronic pancreatitis. Pancreatic echogenicity appeared to be the most sensitive variable in detecting pancreatitis. There's been concern raised that hypoproteinemia could affect assessment of pancreatic size when evaluated by use of ultrasound in dogs, but this has not been critically evaluated in cats. They do not believe in this study that decreased oncotic pressure from low protein leading to pancreatic edema was a confounding factor, because only 6 of the 23 cats had low albumin, meaning less than 25 grams per liter, along with an ultrasound that showed enlarged pancreas. And nearly all of them had increased lipase values, which were 6 times DGGR lipase and 5 times feline pancreas-specific lipase concentration. More overall, pancreatic ultrasound findings and the 2 lipase assays had poor agreement, and on the basis of the present study results, pancreatic enlargement, hypoechoic pancreas, and irregular margins are most reliable. So overall, good study. It's an impossible task to challenge, unfortunately, with feline pancreatitis, more so than canine. So the takeaways I would say for veterinarians who want to know basically what to think about with this is don't rule in or rule out pancreatitis just based on the ultrasound findings and how they correlate with blood work. And also, because a lot of the treatment for pancreatitis is going to be similar to any other cause of GI disease, of anorexia, lethargy, vomiting, abdominal pain, probably if you are misdiagnosing or over or underdiagnosing pancreatitis, but you still give those treatments for that patient, they'll probably still get better regardless of whether or not it's pancreatitis or any other GI disease. So you should be communicating with pet owners that although the blood work may suggest or not suggest pancreatitis, it cannot be sufficiently ruled out, but the treatment will be the same anyway, and then you treat aggressively or not based on how severe the clinical signs are for that animal. And then go from there. Obviously, your gut instincts as a professional should also come into play too. If you have an obviously raging pancreas on ultrasound, and regardless of what the blood work is showing, if it's not correlating with the ultrasound result, then you treat what you see and go for it. You've got physical evidence of it. And obviously, if you have the opportunity to biopsy the pancreas because it's indicated in that case, then make sure to either practice on a necropsy of how to biopsy pancreas, or talk to a surgeon or research it. You can talk to Vet Triage Pro for vet-to-vet consultations, and we can talk you through how to do that. For pet owners, realize that it's not your veterinarian's fault. Cats especially are very tricky when it comes to pancreatitis because undiagnosed chronic pancreatitis is a reality of cats, and those can cause changes to the blood work and to the ultrasound that don't necessarily correlate to what's happening with the cat right now. And pancreatitis is tricky because it can lead to other more severe diseases, including diabetes, pancreatic abscess, shock, things like that. So your vet is going to have to take it seriously. Even if there's no obvious evidence or the evidence is conflicting, they're going to have to treat for the worst case scenario, and pancreatitis might be the worst case scenario. Also, don't forget too, as pet owners, that cats with pancreatitis can also show no symptoms. They may have something as simple as just a little bit of weight loss because they're just not eating 100%, but they're still eating, and that could be a sign of chronic pancreatitis in cats. They're not as obvious with their symptoms as dogs are. So those are the 2 takeaways I would say for veterinarians and pet owners. I'll see you guys in the next video. Take care.